when I was seeing my HIV patients, they often need a primary care doctor and a referral from a primary care doctor in order to be seen in the HIV clinic because it's a specialty clinic. That also meant that many patients really liked what we provided in the HIV clinic, and they asked if I could be their primary care doctor. And unfortunately, often I had to say no. I also had patients who came for PrEP, pre-exposure prophylaxis for HIV, who had had difficulties to get that service from other primary care doctors, or also were looking for somebody who could provide them healthcare in general in an understanding way, and understanding the special health needs that may be associated with being a part of the LGBTQ+ community. That gave me the idea that maybe we should start a primary care office focusing on these populations. I reached out to the leadership of LifeBridge Health at the time, Neil Meltzer, and he actually responded that he had had the same idea because he had been approached by members of the community asking LifeBridge Health to do something in the area. And then I answered, well, maybe I can help out. So I offered to work with opening a clinic for LGBTQ+ patients on a part-time basis because I'm still an infectious disease doctor at Sinai. And that's how it all started. That was the seed that started AffirmCare. And now we are here. It is important because many patients historically has been discriminated against, or there have been barriers, or there have been situations where they just been met by awkward silence when they ask for certain services or screenings, etc., that might be associated with their practices. I wanted to get around that. And I know that it's not always easy as a patient to have to point out and ask exactly what you need. You want that to already be there. And you don't want to be treated in a special way. Not more than any patient is always supposed to be treated in a special way because everybody is special. But I want to provide an inclusive and understanding environment and to be somebody who can meet patients where they are and to help to fulfill their needs in terms of healthcare. So historically, many members of the LGBTQ community has been avoiding healthcare because of experiences of awkward conversations and awkward interactions with office staff and providers. I want to avoid that, and I want our place to be a welcoming place for everybody. And I want everybody to feel comfortable and welcome. First of all, welcome. We're looking forward to help you, and we hope that we will be your choice. My goal is to make this the best primary care office for the population in the area. The primary care is pretty much the same as for the general population, but it may need to be provided in a more understanding way for certain health needs that exist for the LGBTQ population. So to address those needs and screenings that might be needed is important. I will say it's not only caring bravely, it's caring boldly. That's what we want to do. We want to provide the best possible care for everybody, including groups of people that has historically been disenfranchised when it comes to healthcare. And that includes people of all backgrounds, orientations. I want it to be a diverse clinic for everybody. And I want everybody to feel welcome without being specially sorted out because you doesn't belong to a certain group. I want everybody to be welcome.